Hello, everyone. Good
Hello.
morning, good afternoon, and good evening from whichever time zone you all are joining in from. Thanks for showing up today for this healthcare webinar. We are really excited as AI Core Spot. First of all, hope you all are having a fantastic day till now. Today, we'll kickstart the discussion with a very exciting topic, which is driving healthcare innovation through data analytics and AI. We are really excited to have you all here. Let me begin by introducing myself and AI Core Spot to you. My name is Nitin Naveen. I'm Vice President Innovation Strategy at AI Core Spot. With around a couple of decades of experience in different consulting firms, and I've dealt with a lot of Fortune 500 companies, feel fortunate to consistently engage with numerous stakeholders, a lot of global leaders, and their incredible problem solving and innovative ideas. Joining me today, a couple of my colleagues. Arvind, you can see he's there, and Naveen is there at the back end, who will bring and add some energy to this event. So a big applause to them for their dedication and hard work to bring this event in shape. Now, let me tell you something about our company, AI Core Spot. It was founded around 4 years back, and it was created to serve as a knowledge hub focusing on different emerging technologies like AI, ML, IoT, robotics, and much more. Our webinars aim to share the latest technological advancements in different industries, and we dive into various tech sectors, unveiling a fresh theme every month and steadily gaining momentum. Our goal as a platform is to become the leading AI-driven community worldwide, where individuals like you with similar interests can contribute to mutual growth and success. We as a company is committed to organizing industry-backed webinars and hybrid events, grounding our knowledge through a lot of incredible data from industry leaders, subject matter experts, thought leaders, and all our trusted partners. Additionally, we fine-tune our content across various digital platforms which we have. It's through blogs, podcasts, videos, newsletters, which shed light on the ever-evolving industry. Now coming about today's webinar for which all of you are here for. As I said in the beginning, a really exciting topic is up for today, which is how healthcare innovation is driving through data analytics and AI. Our speakers will provide details and deep dive in few pointers like foundation strategy and infrastructure, implementation and adoption, advanced analytics application, ethics of healthcare, future, and many which is going on in the healthcare industry. Our expert panels share valuable insights and thought-provoking discussions that you won't want to miss out. So let's kick off the discussion with some quick highlights. Meet our community partners for today. We have 6 great companies, which includes United Healthcare Group, UNOS, InfoVision, Community Health System, Seniors Health, and Premier INC, who played a crucial role in making this webinar a success. Also, a big thanks to all our attendees. Your time and presence means a lot to us. We appreciate your being here to achieve your goals and connect with fellow participants. Our platform's main goal is to help you gain valuable insights and build meaningful relationships. So if you lead with a few innovative ideas or build new connections, we'll consider it a job well done. Now let me introduce our esteemed speakers for today. Our first speaker is Mayank Kumar, who is Director of Data Science at United Health Group. Our second speaker is Neelam Singh. She is Director of Data Analytics at UNOS. Our third speaker is Laura Xu. She is Director of Analytics and Informatics at Community Health System. Our fourth speaker is Glenn Ferguson. He is Associate Director, Advanced Analytics Center of Excellence at Seniors Health. Our fifth speaker is Tim Riddle, who is Senior Product Director, Data and Analytics at Premier INC. And sixth speaker and moderator for the event is Mark Johnston, who is VP, Global Healthcare and Life Sciences Innovation and Strategy at InfoVision. Just one-liner disclaimer before we start, and I hand it over to Mark. The views shared by all the speakers are their personal ones, and it's not related to any organization which they represent for. So now over to you, Mark, to begin this exciting panel discussion.
Thank you, Nitin. I appreciate the introduction and our esteemed panel members. Good day, everyone. Welcome to our webinar, Driving Healthcare Innovation Through Data Analytics and AI. My name is Mark Johnston. I'm the Vice President of Healthcare Innovation and Strategy for InfoVision. And InfoVision is a global transformation leader with a team of over 3,000 dedicated innovators enabling meaningful change across industries. Today, we're going to be talking specifically about healthcare. I lead that healthcare innovation practice. And in my role, I've witnessed firsthand the transformative impact that data analytics and AI can have on healthcare, from enhancing clinical workflows, improving patient outcomes, driving operational efficiencies, and fostering innovation. I think what's key here is these advancements are only possible when they're built upon a strong data foundation. In today's healthcare ecosystem, data is not merely an asset, it's the foundation upon which innovation is constructed. As we push these boundaries of what's possible in advanced AI technologies, obviously, it's the top of the hype cycle right now to talk about AI, and we're going to address that today, including large language models. The importance of a robust, clean, well-integrated data cannot be overstated. Without a strong data foundation, even the most sophisticated AI systems can falter and deliver inconsistent results or amplifying inefficiencies. LLMs thrive on high-quality data and the potential to generate meaningful insights, improve decision-making, and personalized patient care, which hinges on how effectively the organizations can structure and manage and analyze their data. Today, we're at the forefront of data-driven revolution in healthcare. It's a pivotal time when analytics and AI are converging to solve some of the most complex challenges the industry faces. That's why I'm thrilled to facilitate this discussion and dive into how data and AI can drive sustainable innovation. And throughout today's discussion, we're going to explore key themes. They're going to be including how to establish a strong data foundation to enable AI and LLMs to work effectively, the strategies and challenges of scaling analytics capabilities, leveraging predictive analytics and AI to improve outcomes, and navigating governance, ethics, security, and data-driven healthcare ecosystem. So with that, let's begin by exploring foundational strategies. And to start, Glenn, I think I'd like to start with you if I can. I'd like to pose, and everyone can add here, and we'll go around the panel. I'd like to pose the question to our panel: how are you advancing data-driven decision-making in your healthcare area? And what strategies have been most successful in building a strong data foundation? I think that's a good place to start. Glenn, can you lead us off? Glenn, I think you're on mute.
There we go. Thank you. Just to start off with setting the context, Syneos Health is a contract research organization. So we have a clinical data science team that works on clinical trials and a commercial data science team that works on commercial projects with our pharma partners. So in addition to that, it is a global. So we run clinical trials across the entire world. It's very, very common to have clinical trials running in many countries at the same time for many different clients. So that's sort of the basis for it. So we have a lot of very complex data. One of the biggest things with data foundations is that you have to have extremely robust data. How can you do that? Well, if you have a lot of different systems, this creates a challenge because you might have clinical data management systems that are across many different countries and have many different times of updating and ways of entering data. This can all create a lot of confusion with the data. So master data management is a really important concept in order to get all of this data aggregated into a form that's entirely usable. So you can't have one thing that means something in one system and has a different name but means the exact same thing in a different system. It turns out to be very common, and it's a very big problem. So you have to go through, and the entire organization is going through that process of coming up with the best possible master data management in order to ensure that the best foundation for it. And in addition to that, it's reorganizing the structure of the teams. So we have data science teams that can effectively build models for the data, and then effectively scale those to the entire organization.
And Neelam, in your organization, can you give us your perspective on how you're advancing data-driven decision-making in your area, which is unique?
Sure. So just a quick introduction. So I'm Director of Data Analytics at United Network for Organ Sharing, also known as UNOS. And our mission really is a life-saving mission. So we have the organ procurement and transplantation network contract from the federal government, and we have been managing this contract for about 40 years now. So the main goal of my team really is, I'm leading the data analytics function here. The overall company goal is life-saving mission. However, the how we do that is by strengthening the community and also strengthening the system. So folks have what they need to make the right decisions, informed decisions, and then have more transplants available to folks who are on the waiting list and ensuring more lives are saved. So I think just keeping in mind with that mission, my team's goal really is to support decision making, providing enough information to surgeons, clinicians, and people on the ground, so that they can remove any administrative burden from their workflows and make sure that they're maybe making right decisions. Mostly because there's only so much time you have on the organ offer, so making sure that there are insights into their own practices, like how they are accepting organs and what are their practices and if they need to tweak them. So we have built a ton of tools around that, and just making sure that, because also we are collecting so much data, very complex data, just making sure that the data quality is good. If there are any missing elements, if there are any errors in the data, we catch them early and provide them to hospitals across the US, so that people can make timely changes, because some of these data points are so critical in that decision making. So it's very necessary that we have clean data. Also, reporting and analytics is also something that's feeding into hospitals' workflows and also patients. Now, patients and their families are more aware than any other time. So just making sure that they have the insights to make decisions for their own selves, and they can have informed conversations with their providers in hospitals. We serve about 250 hospitals across US. So just making sure that we're keeping up with the trends and providing the right insights, hearing from them, and have a proper feedback loop to get information, so we can feed it back into our roadmaps for enhancements.
I appreciate that, and I appreciate the introductions. I think that's a good piece that we need to cover here too. It gives perspective, I think, to the audience to understand exactly what your role is and who you serve. And part of this, or all of this today, everybody impacts at the end the patient, which the consumer, patient. And with that, Laura, you're coming from and all of our other participants here on the panel are coming from developing analytic strategies to improve patient care and operational efficiencies in delivering care to patients. I would like to get your perspective as well, Laura, and then we can move through the panel.
Hi, thank you so much. So yeah, for a little bit of contextual background here, as the director of analytics for Community Health System, we're in Fresno, and that's the Central Valley of California. We are the only level 1 trauma center between San Francisco and down to Los Angeles. And before I moved here, I didn't really have a perspective for just what the geographic range of mileage of lives covered there. But that's, all the way from Yosemite National Park down to Sierra and Sequoia and Kings Canyon National Park. So if you have any unfortunate accidents while you're visiting there, chances are you'll be coming to visit us. So we have 3 hospital systems or hospital facilities, but we also have a health plan. And we also have a provider network. So we truly are the example of the integrated healthcare delivery system. And when I think about what we're doing in terms of analytics to advance data-driven decision-making, you really only have 2 options. And when you're making decisions, one is you can go with your gut, your experience, and the other is you can seek objective information. One of the biggest challenges that we have had, not just with COVID, but with some of the economics of the Central Valley of California, is in our capacity crisis. And I know that we're not alone in that capacity crisis. And so we've spun up a capacity command center, like many, many other similarly situated healthcare systems. And we use quite a bit in terms of real time and some predictive analytics to manage our capacity command center. And in terms of what it takes to make these successful, where we have a clearly identified and data literate operational champion is where we tend to find the most success. I'm very proud of our executives and the way that they have leaned in and learned to use these tools directly themselves.
I can probably add a few things, Mark. So hello, everyone. This is Mayank.
No. Go ahead.
So, just giving a brief context about my background, and that's where it may take a different angle. So I come from a payer organization. I kind of have worked through my tenure in the space of claim operations analytics, provider operations analytics, payment integrity, kind of dealing with healthcare fraud, waste, abuse side of the world. So puts a different angle to how we approach it from a payer standpoint. Now, coming back to the foundational question on how do we drive data-driven decision-making, I guess, it's more of a culture, something that Laura mentioned. I'll kind of pick up on that. It has to come from the top, right? So the executives have to be on board in terms of kind of driving that across the organization. Now, I know that there are usually challenges in broader adoption across the leadership. One of the things that I've seen to be successful is whenever there is resistance, the first and foremost thing that you can do is find those early adopters on the operations or stakeholders or leadership side, work with them for a successful POC and use that as a case study across the board, because the more you kind of navigate through or socialize those successful case studies, the more leaders start onboarding and supporting that, yes, we need to have AI as an agenda or as a core part of our overall strategy. That's one thing that usually works out successful irrespective of the size of the organization. For most part, it is a given that today, I think the C-suite understands, the CIO, CEO, COOs understand that analytics is a differentiator, so they have to definitely invest into it. I think the question mark obviously comes in how big of an investment it should be and where should they start, right? They would not want to take a full-blown approach or end up boiling the ocean. So that's where I think I see some reluctance on how much money should be put into pure play analytic investment. Now, the second thing that I have seen being successful is a lot of the organizations that are getting a little bit mature in their AI adoption and journey is putting CDAOs into the solutioning phase of the business problem. So the business solution should not just be a conversation on the business side or just on the CIO side. There is another arm or there is another position on the table that you should start bringing in, which is the CDAOs, so that when you are bringing up a business problem, the tech guy is thinking more from an integrations and systems standpoint. The chief data analytics officer or whoever that representative for that business vertical is thinking on, okay, is there a play for analytics? Are there pieces of this overall business problem or operational workflow that I can kind of optimize using AI, data science, or even pure play dashboarding reporting, right? Bringing forth those insights. So those are some of the things I've seen kind of working out pretty well. I think there was a second part to the question mark that you mentioned, which is what should be our kind of core data foundation strategies, right? What are the things that we need to consider? Usually there are kind of 6 dimensions to, so when we think about data foundation, the first and foremost comes as data quality. So there are 6 dimensions to that. Adequacy, accuracy, consistency, validity, completeness, the timeliness aspect of it. What I've seen is, obviously it works with having simple rules for you to checking the validity of the different values, completeness of records. So that is a simple rule-based implementation. Somebody who is a subject matter expert in that particular business area can help build those rules over a period of time. And then what I've also seen now is that mature organizations are starting to leverage for multivariate scenarios where we want to check for consistency of a particular record. Let's say if I take the example, I receive a claim, and a claim has various attributes. It has the procedure code, diagnosis code, modifier, provider identifiers, member identifiers, and so on and so forth, the policy. one of the best ways you can check a multivariate consistency is using ML solutions. Those are kind of purpose built to check those multivariate correlations. So you can come up with a data quality score in that sense. So that's on the core principle, right? When you think about data, you have to have data quality at the foundation of it. One of the other key things about your data foundation strategy should be around security, which is a big thing in healthcare with all the regulations and compliance that we have to follow. And then from a business standpoint, what I've seen working is, again, I think Glenn mentioned that we have, in healthcare, usually we have proliferated data. We talk about multiple dimensions and multiple entities of data spread across systems. And one of the things that has worked well is you cannot have one data that kind of does all and be all of everything. You have to have, in such a proliferated environment, you have to start defining data products, right? So, and it could be by subject areas. For example, in the payer organization, claims data can be one of the data products, provider data can be another data product, member or patient data can be another data product. So start defining data products, and the onus of the onus of quality, security, and governance should be managed by data products. So that just kind of makes it more easier. And each data product has a product owner on the business side, as well as then a technology owner on the tech side or the CDO side. And that, from a data foundation strategy, kind of works well to navigate it through, manage it on an ongoing basis, and build from there.
And I appreciate that. And before we move deeper into data quality and data silos, there's so much to dig deep down into that. I want to reach out to Tim. As Laura had mentioned, leadership commitment. We've heard business personas involved for early on, and the involvement of the chief digital officer, obviously. Tim, if you could give a brief introduction, a little deeper background on your perspective too.
Yeah. So hi, I'm Tim. I'm from Premier. Premier. Essentially, we have a couple different arms, one of which is the group purchasing organization, but the arm I am representing is really around analytics. And we have a lot of analytics solutions that our organizations trust us to provide our organizations, and also life sciences and pharma that trust us to really drive improvement, right? And so when I think about this, as far as and I have about 25 years in healthcare analytics experience, when I think of this, since there's already been some good answers on MDM and things like that, every piece of data we collect, we try to put rules around it. We try to make sure it links to other pieces of data. We have about 45% of all discharges in America we collect from our member organizations. When I think about how to set up a good data foundation, stuff that hasn't been mentioned, is what story are you really trying to tell? So one of the things I always tell folks when my kids ask me what I do for a living, I say I tell data stories to keep people safe. So really, what story are you trying to tell with the data? And that's another useful tip I just think for the folks that are attending today, because then you can work backwards on what should be your fundamentals in your data strategy. You can start with the fundamentals, or you can start with what are you trying to do with the data to drive change. Now, there's two approaches, but I think if you think of it both ways, you can kind of meet in the middle. And when you do that, you kind of get your fundamentals. Say, okay, what data rules do I need to put in place for the domains I have? We also treat data as a product. One of our products actually sends just data back to people, and it's not an interactive application. And so when you really think about the fundamentals, you want to figure out what fundamentals do you need to tell the story you want to do to drive improvement. And I think that's where we land. There's many different ways to do this, but the other thing I think that's important to think about is the people involved. That hasn't been mentioned. A lot of focus on tech stacks. That's critical, but your operations team, your clients or customers, either internal or external, really drive the quality of your data. And since everybody's a human being, how does that system interact to allow you to get to where you want to go?
And you mentioned a successful initiative. I would throw that out to the panel. Anybody that wants to take it is, what have been your most successful initiatives in driving the adoption of analytics within your organization?
So I'll take this first.
Sure. Go ahead.
Yeah. So if you look at how do we adopt things, one of the just to pick up something that Tim said, the data storytelling, if you're coming up with a data science answer, it can just be a number, a regression, or a category. And this may not be particularly useful or meaningful to anyone until you put it in the context of a story. So you may have the same predictions served in different ways to different groups because different stakeholders have things that are more important to them or less important to them. When you're running clinical trials, you can want them to happen as fast as possible, or you can want them to happen as cheap as possible, sometimes both. But the idea behind it is if you're telling that story, you may have the same models doing predictions, but you may be delivering different information from those predictions. So really giving the stakeholder actionable information has driven adoption very well for us.
That's excellent. And Laura,
tag on to that. And one of the things where, there's many different kinds of data too, as mentioned in that, and I think it is defining the story, right? So the final piece I would give is one thing we tell folks is insights without ability to drive action is kind of meaningless. So back to the point that was made, if you just give somebody, well, you have an opportunity on labor costs, or you have an opportunity in utilization of something, or for clinical trials, right, you have these many folks to go reach out to. So I give something. So one of the things we're also always working on is how can you take a result like somebody might be getting blood when they're not supposed to be because their hemoglobin's too high in general, considered evidence-based medicines, and how do you wire that up to a decision support system that actually fires an alert to a clinician when it's time? And so I think that's important too, to just think about side is retrospective analytics, on another side is real time. How do you mix the two to drive change?
That's good. I think we've talked about contextualizing the data, which is key to drive stakeholders and understanding and interest. Laura, do you have maybe an initiative that you could share?
I was thinking about this, and I think what I'm going to do is I'm going to steer clear of the specifics of the initiative, and I want to focus on making it more generalizable to the qualities and characteristics that make it successful. And I think that we have a recipe here. And by the way, I when I first started here, shortly or in my first year, I actually did an round of interviews with all the senior leaders, and I asked them for an example of our most successful analytic initiative here, and they were very consistent in all giving this same example of the product that I'm talking about here. So a couple of things. Number one, our executive champions, and in this particular product, we have a partnership between our clinical and our business leaders. So any decisions made around this product are made in partnership with those two people. So that's one key. Somebody else mentioned the skill set. So the skill set of the business intelligence analyst that is providing this product, the structure that this individual has built. So you got to have in analytics, I think you have to have a stable product. One of the things that I've found is that when you give people something they like and it's answering questions, the number one thing they do is come back with more questions that they want answered. And if you don't build rigor around that, so how do we understand the additional questions and the enhancements, and how do we build some structure around that, right? If you are constantly putting changes in, then you don't have a stable product. So this person has on her own built some governance really around how we do what we now call enhancements to this product and batches them in cycles. We had some issues with access. We had some issues with adoption. If we start to talk about the adoption piece, I think one of my biggest frustrations at times can be the data piece and the analytics and the tech. That's always the easiest part of the equation. It is, what are we going to do with this information once we have it? That tends to be a bit trickier in the follow-up around that. So if you start with almost a gate of we're not going to build until we have a greater deal of comfort around where's this information going, what's the outcome, and how are we going to measure the ROI on this? We haven't talked about this, and maybe we're going to get into it later, but analytics has a relatively higher total cost of ownership. When we talk about the technology and we talk about the people pieces, and we talk about the skill set, the education, and the training and of analytics resources, they tend to be on the higher side. So I think it becomes really important that you have the ROI built in and baked in upfront. I love these conversations. This is an audience where I can engage you thoughtfully and meaningfully around some of the more academic concepts and analytics. The reality is our boots on the ground. I think other people have alluded to that with the storytelling. You have to be very concise and very to the point and on point with your messaging with these executives too, because they have a lot of competition for their attention right now.
That's a great
just
point.
To
it kind
follow
of
up
leads
with
me.
that, on that, and I'll be quick. Our most successful initiative in recent times has been reducing the cost of ownership of doing analytics. Directly back to what was said. So we're really trying to make it an assembly line. It's a product we actually sell to health systems called Insights, but it's also a product we use internally by building blocks on how to deliver new analytics. We have 2,500 measures and indicators. We have an infrastructure, we have a team, we have a place, setting up an assembly line so other people in the organization can build their own analytics.
And Laura brought up a great point. When we discuss the higher cost of analytics, there we're talking some of the tactical things of data infrastructure storage, the tools, the platforms, the talent, the expertise, right? The governance and the compliance, and the technology and the maintenance, and you've got the security concerns. So I think to give some context to that, I think as I see it is the kind of the higher costs of why that's a high cost area. You bring up some great points there too. I just wondered if anybody else on the team, how do you measure and communicate the impact of these initiatives that we're discussing today? And that's a key part of it.
I could take that one at first.
Sure.
When we're in the pre-award space, so we're trying to win business, it's very straightforward to do it because you get a direct link to the ROI. That's very fortunate. When you're in this space after it's been awarded, where you're trying to help them select sites, narrow down different types of countries, etc., it's much harder because you're looking at speeding up workflows at that point, which is not the same as this is a direct ROI dollar cost, which you get from business awards. So it's really different parts.
Yeah, and we've got some different personas on our webinar today, which is fantastic to have. But I would also ask on the patient side of things, patient care side of things, going back to Laura and Tim as well. How do you measure and communicate the impact of these initiatives?
I'll go real quickly. It's whether or not you're getting better, right? So we do a lot of benchmarking for our healthcare organizations we serve. We do a lot of risk adjustment, a lot of fancy data science. Sometimes there are hundreds of risk adjustment models, but really at the core of it, there's one thing we're measuring: are you getting better? And we're measuring on the back end, and then we're measuring some of the alerts that we're firing on the front end to determine if those are being used.
And one of the things that we hit upon too was the quality of the data, the old junk in, junk out. I think also as we look at applying AI and large language models, if we're using private data, the quality of our data is going to determine how successful we are with those implementations of large language models. It's very key. And I work with a lot of providers around the globe, and data is siloed still to a certain extent. Data is not in a foundation where it can be successful or become one truth. So I would ask the panel too, as we look at that transformation on quality of the data and ensuring quality of the data. Mayank, do you have any thoughts on that? I'll start with you.
Yeah, so I mean, if I talk particularly in the context of large language models, I mean, I would say quality is not a constraint from that perspective, because we don't need data to kind of do fine tuning. We are not in a stage where we are kind of fine tuning large language models. If you have to do that, then yes, probably you would need data and you would need to have a qualitative data. The way we are kind of using large language models is more in a RAG sort of an implementation framework, right? Where we have the base large language models from some of these providers, and then we are kind of giving it a vector database behind the scenes, so it is able to retrieve the content from there, and all it is doing is that English summarization and helping make sense or insights out of it. So I would say quality is not that big of a concern in the play or space where we are talking about large language models. But yes, it's still a lot of use cases that we do deal with structured data. So there is definitely quality constraints there, and kind of, again, coming back to the same thing, right? Proliferated data, a different source of truths, that does raise a problem. I have not seen a platform or a framework based approach working for that. I mean, data quality is something that has to be solved for individually. As I said, I mean, you have to, if let's say your business area is too much dependent on the claims data, you have to have claims data as a data product. And then you have to have data quality as a foundational piece on, okay, defining those rules, metrics in place. And obviously that will also build over a period of time on, okay, what makes sense as a claim data is coming in, what are some of the missing pieces, having a proper data lineage in play, because even when we are talking about claims in a insurance world, it's not like it's a one and done thing. There is a life cycle to claim. I mean, we get it as submitted from our providers, then it goes through the adjudication phase of it. We kind of pay, deny, do whatever with that. There's a post-adjudication phase of it, where on the same claim we may end up receiving appeals or rework or reconsideration from our provider. So there will be subsequent changes to that. So it goes through multiple systems. Even one single claim is kind of navigating through the system. And it is pretty valid that, or it is pretty much possible that as this claim is flowing through, there could be data loss, there could be data inconsistencies as it moves from one system to another. Some elements may miss, or the systems are not talking to each other properly. And that's where you have to kind of take that, I would say, cross lifecycle approach or lifecycle agnostic approach to it, where one of the things that, for example, we have tried to do on the claims side is starting to build a snapshot of it at different points in time in the life cycle and keeping that updated. So that gives me an underlying data product. Now I have my data quality rules running on top of it. Simple things, right? For example, whether for a given column, I mean, are we seeing values that we have not seen before? Are we seeing null values where we don't expect null values, right? Missing values. Do we have any problems with respect to the duplicate records or uniqueness of the records in general? So these are very simple rules that you can apply. You can do very simple data profiling, and then you can kind of go to more advanced techniques where for consistency sort of things, you can apply ML algorithms to check for the cross column consistency and make sure that, okay, and that can be seen twofold, right? Is there a systematic problem where for a particular claim, I'm seeing certain attributes that usually don't go with each other, right? So there are machine learning problems that can very easily help you solve for that. There is another, because working in the payment integrity space, I always tend to see things from a inherent fraud standpoint as well. That's how over the years the mind has been built. Often at times, what you will see is that we do get false claims too, where the bad actors are trying to game the system. So they are necessarily, let's say, trying to file phantom billing or mixing up things, doing unbundling and upcoding. Again, your ML model can be seen working in both the places. So same solution. Again, there is a context to it, right? Where you want to see it for something that is helping you solve for consistency, or whether you want to see it something that is helping you solve for identifying wrong submissions from your bad actors or phantom billing sort of scenarios. But yeah, I mean, from a data quality perspective, those are a few things that I have seen working with.
I appreciate that. And I'd open this up to everybody on the panel too, because I think it affects everybody, obviously. In healthcare, we've made great strides, HL7 and FEAR for integrating data. What have been the most challenges you've had, still see as a challenge in data integration? Anybody on the panel, I think it applies to everybody that would like to.
Yeah, I can start real quick. We get trillions of messages from HL7. One of the things we actually make, oddly enough, is disease outbreak software for our member hospitals. So obviously our organization was stressed during COVID as we try to help our members that were under the gun. So we do have a lot of data integration tools. We have a whole data integration team. We're a little unusual in the, versus a single provider organization, which also has a very, very hard job. But we see all sorts of even implementation of HL7 and all sorts of implementation of thousands, if not millions, of flat files. So we try to use standards whenever possible. We also try to use tools, and we also build our own tools. We have a mix, right? Because it kind of depends on the right tool for the right job. But there is no easy answer for healthcare integration. Of course, there are vendors in the market that would want you to pay a toll or really make it hard to get data out of certain source systems because that, again, is their business. So it's a tricky wicket, I would say, and we're continuing to evolve always our data integration plan and strategy. Going back to the fundamentals, right? It's just the first thing is how do you get the data out? And again, what story are you trying to tell with the data in order to know how you can standardize and in what time frame? Are you trying to get a response back to people in sub-seconds? Are you trying to get a response back to somebody next month that they might have a quality problem? Trying to get something to somebody next day. And that'll kind of usually help somebody determine what their integration pattern would be.
And Laura, you're an integrated delivery network. How do you handle those challenges of data integration, and what are the challenges still? I think we've made a lot of progress over the past 5 years, but I'm sure there's still challenges that you're facing.
My perspective is that I've been doing this for a long time, probably not as long as some of the people on the call, but longer than I ever have before. And my perspective is that we're still facing the same challenges. I'm still facing the same challenges with interoperability and standardization and quality that I was facing 15 years ago. The tech has changed, the tools have changed, but the core issues that they still remain. To be a little bit more specific for my organization, I think somebody talked about this in different terms earlier. Analytics hasn't historically been at the table when you're discussing the strategy or the approach. It is something still really often. I can't tell you the number of times we have a go live and then we need this report. We need this data. A system has been purchased. A system has been installed. Oh, we need some reports. We need to get data. So it's not, I think it helps that we have the CDAO role now and can have our people more and more at the seat at the table where we're actually talking about what we're going to do and how. But I feel still like we're in a choose your own adventure story. So if you ever know those books, you know that you make a couple of decisions early on, and those decisions influence really what your options are for the rest of the book, right? Yeah. And I feel that that's still the situation with data analytics and integration.
And you mentioned that choose your own adventure. I mean, how do you see that playing out? I mean, what kind of impact can you have? What would you suggest if you could create a panacea to solve those issues?
Oh, you're going to get me in trouble. We're going to be, when it comes to AI, my organization is going to lean on Epic. We're just not, I think, big enough or comfortable enough that we're going to we're building some chat box, and we have some stuff running on some local machines for very specific things. But we're gonna lean behind Epic. And so if you ask me for a panacea, then let's say Caboodle. Let's talk about Caboodle, right? If Caboodle's really going to be our solution for integration, then I think we have some work that needs to be done still. I'll leave it at that.
Makes sense. That too, I know we have to be mindful of what we want to wish for here, but I think we're growing. I think we're getting there. It's a slow process, but it's interesting as long as, and I've been there as long as you have too, that I just feel like we've made some major inroads in the last couple of years that didn't exist before, where in interoperability, it was very difficult to get that data. So it's incrementally improving, I suppose. Neelam, do you have a perspective on data integration challenges within your organization? Because I would assume they would be complex.
It's definitely complex, and also, having a lot of data teams across verticals also doesn't help, right? Like what happens is then you have different platforms that they're working from. So, in the past few years, we are now kind of come to a consensus that we need the same source of truth. And we've been working towards that. This year, we did a proof of concept to explore if a platform could really bring all of us together working from the same platform. But again, when you do a proof of concept, you get to know what the strengths and opportunities are, and there's always opportunities in these tools. And I'm waiting for a day when there would be a platform or a tool that could, or multiple tools, that could actually fix all of these integration problems. So I liked what Laura said, that what decisions are made at the table by the C-suite early on will actually impact a lot of decisions that data teams will make in the future. So sometimes you just kind of are in a situation where you just make magic happen. You find your, layers of integration. You build something that'll integrate A to B, and then you can have a seamless flow of data, and teams could work together.
Very interesting. And before I close that out, because I'd like to move into advanced analytics applications, does anybody else have any thoughts across that? I'd open that up.
Really
if
quick,
not,
this is.
Yeah, go ahead.
Yeah, really quick. One of the challenges is that we work with a lot of different external vendors for data sets, and it is extraordinarily difficult to look at all of these different data sets and link them together. It's not a little hard, it's very, very difficult. And this has to be a very strong focus of the organization in order to build the foundation in order to move forward.
That's a very important point. With the foundational systems that are in place, organizations can leverage, obviously, advanced analytics, AI, and real-world evidence. That drives us into, the advanced analytics applications. And I'd like to ask the panel too, how if you are, and how you're leveraging predictive analytics to improve outcomes. Anybody on the panel, because I think everybody is either currently doing that or they're looking at doing that, obviously.
I'll go first on this. First of all, if I could, for disclosure's sake, we are a Premier Inc. customer. So I'm going to try to be tool and vendor agnostic in my response, but Premier is one of our, we do use the GPO and Insights and Quality Advisor. So I'll talk about it in a couple of domains. And number one is the quality of care. So if you are a hospital or healthcare delivery system, then you know that there's the CMS Care Compare and the CMS quality measures. Then you also know that's going to be your patient experience, which is your HCAHPS, and that's going to be healthcare associated infections, and it's going to be your safety and your mortality and your readmissions. A lot of the time, well, not a lot of the times, all the time, what you see on the CMS website is going to be performance that actually occurred 2 years ago. And you get your HSRs, and then you know how you did 4 quarters ago. But that's not as useful to us as how are we doing right now. So we have a number of different tools that leverage AI. We've mentioned one of them that tell us how we're doing right now. How are CAUTIs right now? How are CLABSIs right now? How are we doing on our HCAHPS this month? Where do we need to improve and focus our attention right now? Because if the way that I described it before we had these tools in the quality space, it felt like you were being asked to drive a vehicle by only looking at the rear view mirror, right? And so that becomes really difficult. And in some cases, then we're trying to do some forecasting of how we're going to do based on how we're doing right now. So that's one of the spaces, improving the quality of care, which I think is really important. Mortality is important. Healthcare associated infections, really important. We're also using it, so supply chain and resource utilization and operational efficiencies, and then a lot in the revenue cycle. So denials management, CDI, and coding. So those are the three big places. And then, of course, point of care, we use the Epic cognitive computing module, and we have a couple of those models built. Sepsis, maternal, the maternal hemorrhaging, things like that.
Makes sense. We're addressing
quick, one of the initiatives we have. I mean, I think echoing Laura's points about getting closer and closer. What's happening now versus really old quality measurements, no matter what part of the industry you're in. Well, one of the things we're really focused on is what's going to happen, and from that perspective, we have a major initiative on who are the most vulnerable. So all of us have different walks of healthcare where we're coming from. But I think everybody can kind of assess and determine that being poor in America is like the ultimate bad social determinant. And so what we've done is we've taken a lot of the clinical data from a lot of our member organizations and matched that up against with some social determinant data that's patient specific, figure out who's vulnerable and who may have a bad event later on, so that the organizations we serve can do better outreach, right? So that's one of our focuses, is like helping stop something happen before it happens. Now, we're not the ones doing that. It's our members, honestly. So we're just helping, providing a guiding light of kind of the rising risk of a patient based on their income, based on what's going on in their neighborhood, things like that. And I think that's critical to try to get ahead of a lot of our health in America, is what can we do to make things better before it becomes a train wreck?
That's very interesting, and we're involved in. I'm not going to go into a discussion here today, though, on the predictive side to, be able to predict those that may come into a certain disease and in front of the curve, which will be interesting to see as we move forward, and even employing genomics at some point. We won't divert into all that discussion today, obviously, but Glenn, can you give us some insights on leveraging predictive analytics to improve?
Definitely. This is a very big focus of ours right now. As I said, you want your clinical trials to finish as fast as possible, which means you have to find your patients, which if it's a very directed trial, can be very challenging. So we have predictive analytics to predict at the site level, which is going to be the clinic or the hospital, how many patients are they likely to enroll in a certain amount of time. In addition to that, we operate in many, many countries, almost every country. So we have to say, okay, there are regulations that are vastly different in every country. Can we predict how fast sites can start up to enroll patients in the country? So we're looking at these multiple predictions, and how can we use these together to say, okay, this is how we're going to go into this country and how many people are likely going to enroll in that country. This is very challenging. If you look at past data, because I can understand if you look at past data from this may not be very meaningful for future studies, because the values change. It's very characteristic of the clinics. Could be very characteristic of the doctors and which patient populations they have. So really trying to get all this information and put it into home-built analytics that we have for these, and these are ones we built ourselves using our own data. You can do good predictions and have some really excellent predictions from these that allow you, and then you have to work on balancing those correctly to say, okay, this is the right mix to have this happen as fast. And if it's not patient care, but if you think about it, if there's a drug and there's no first line treatment for your child who has cancer, you want that clinical trial to happen fast.
It makes a lot of sense. Mayank, I'm sure in your end of it as well, this is critical for you, and you're doing a lot there too. Can you?
Absolutely. So when I think of use cases for predictive analytics, I would try to first of all divide it in areas, right, based on the outcome we try to achieve, right? So you can think of predictive analytics in healthcare as something you can use to drive quality of care for your patient. The other area that we tend to use it is improving on consumer engagement. And when I say consumer, from a payer standpoint, both patients or members as well as providers, which is the healthcare providers, are what we consider as consumers. And then the third area where you can kind of use this is for I would say better member acquisition, right? So more from a marketing standpoint, those which will directly impact your top line. And the fourth area is how do you kind of use predictive analytics to drive efficiencies in your bottom line, be it from a medical cost or from a operational cost standpoint. Taking examples, so quality of care and the marketing side, I'll just take a few examples, but those are areas that I'm not engaged in detail over my tenure here. But from a marketing standpoint, with these large language models and generative AI coming in, one of the ways we can or we are trying to leverage generative AI is analyzing a lot of these marketing advertisements from our competitors and trying to stay ahead of the curves, right? So generating those insights automatically and then pushing that down to our leaders who can take or kind of understand the trend. It's like an assistant to them, right? Somebody who is reading in all of these different channels of marketing media and kind of feeding that constantly to our marketing department on what other of our competitors are trying to do, and then what strategy should we be devising to cater to that, right, or counter that. So that's one area. From a consumer engagement standpoint, one of the areas where we have used predictive analytics, I would say predictive, prescriptive, whichever way we want to use it. So with generative AI, again, there has been an improvement in how we devise chatbots. There has been more of a human angle to it. We are very given the regulated environment we live in, we are very careful in terms of making external facing chatbots yet with generative AI. But what at least we are trying to do is using generative AI to support our advocates, be it the member or provider call center advocate. So that's one area that has kind of worked out pretty well. Obviously, we are using predictive prescriptive analytics, not necessarily just generative AI. We are kind of using that to analyze a lot of our call center transcripts on the nature or the topics of the discussion, where the pain points are, how do we kind of use that to drive digital channel adoption and reduce our contract rate. Then kind of coming on the bottom line side of it, one of the areas where we have used predictive analytics very extensively is for fraud, waste, and abuse detection, which has a direct impact on the overall medical cost. So identifying bad actors or identifying claims that are clinically aberrant or incorrect, unbundling, phantom billings from those standpoint. And then from an operational efficiency standpoint, we use predictive analytics a lot in driving inventory optimization, right? So in the healthcare space, there are a lot of workflows where you are doing manual audits of things. I don't think we are at a stage here, or we can ever be, where we can completely automate a workflow basis machine learning. We have to have a human angle to it. But at least what we are trying to do is, with the staff shortage that we have, be it on the provider side, payer side, whichever, if we have a clinical staff shortage and we cannot audit the entire inventory, how do we prioritize which ones should we be auditing, where there is a maximum ROI in terms of some sort of error? And that's why we should be looking at those claims from a clinical standpoint versus others. So that the inventory prioritization is one of the big areas. Obviously, with generative AI, we are trying to do a lot in terms of document letter generation, document reviews, right? So medical record audits, how we can automate certain aspects of that. So yeah, I mean, those are some of the use cases that come to my mind, and these are pretty generic. I mean, pick any payer organization and workflows. I am pretty sure that in different business segments, these are kind of the use case that will fit in well, and obviously with varying degree of feasibility and value that each one of these generate, but are kind of very pervasive and definitely some of the things that that we are pursuing.
That's very interesting. I think everybody's looking at applying it in a limited way to improve operational efficiencies. And obviously, the chatbots that are out there today are very, in a conservative manner. There's a lot of concerns still as we move forward to, I guess I don't use the word unleash chatbots yet. I mean, they're in use and have been used for years, but we're in a very interesting area here too, where we're talking about healthcare. We've got to be very careful in how we connect with the patient or the consumers. With that, we're coming on the top of the hour, and I want to make sure we get these questions. And so we got some great questions here as well. So, Tim, I'm going to start with you, and I think Laura, and I know some of the other panel members can join in here too. But Tim, I'll start with you, and Laura, you can chime in here as well. What strategies can healthcare organizations adopt to pivot from focusing on operational efficiency, which we just kind of focused on, with data analytics to creating more patient-centric solutions to enhance outcomes and satisfaction, patient satisfaction? Tim, do you want to start?
Yeah, I'll start briefly. So it's an interesting question, and one of the things that might challenge the questioner on is, why can't you do both? And what I mean by that is a lot of times when we're looking at stories or things to really use analytics for and ranking them, we have a workforce solution that cuts across both inpatient and outpatient. And if you're understaffed, that means the patient's going to wait 24 hours in your emergency department, as an example, in a provider organization. So one of the things is you might be able to focus on operational efficiency while still improving patient outcomes and satisfaction, while kind of ranking what you're doing in analytics on things that might be both. I know it sounds rather simplistic, but that I think could be incredibly useful. So we do go through like a ranking mechanism, kind of treating and the analytics we're doing as a product, because we can't do everything. And so one thing to just think about is operational efficiency leads to better patient outcomes and satisfaction. It's also true for when we help people with clinical trials and things like that. So that would be my quick answer is try to rank these things on different domains and then figure out what cuts across domains so you could maybe get more efficient at whatever part of the healthcare process you're in, still improving outcomes and satisfaction.
I think that's a good point. And also, I agree. I don't think they're mutually exclusive to each other too. And I think some of the operational pieces actually will contribute to patient satisfaction in the long term, making things more efficient for access and proper care be delivered. Laura, you think have some thoughts there too?
Yeah, this is making me smile because I think this really gets to the heart of the issue and why at the end of the day we're all here, not working for Wall Street. And we're here, it's the humanistic angle. It's the people side of it, right? And so on the front or back end of these processes are people and humans. So I like to think of it in this like a triangle, right? And so you've got, it doesn't matter who's at what point, but one point is the caregiver experience, whether that's, clinicians, traditional providers. Then you've got your patients, right? So people, and then you've got your outcomes. And so two of those are very humanistic. And one great potential application that comes to mind as I think of that is look at all the feedback that we collect. So I mentioned HCAPS earlier. I know that we make discharge calls and we collect a lot of information, whether it's through the bedside or patient portal or through our patient experience vendor. And I think all of us do those employee experience surveys where we get a large amounts of structured and unstructured data. This is a perfect use case to kind of integrate those various sources together. And we now have the tools and technology that could really inform and transform the patient, caregiver, and healthcare outcomes. Put those two together. So that would be my dream come true if we could make a lot of progress. Putting those.
And if you look at our panel composition today, everybody comes from different parts of healthcare. We've got a couple people similar. But what we're all doing here is affecting, reducing costs, improving access, improving outcomes, and it's all about the patient. That's why all of us, every person that's sitting here in front of us is involved in healthcare today. I hope everybody in healthcare is trying to achieve that goal. That's where we need to be. And before I close that question out, does anybody else have any other perspective? Neelam, do you?
I would just add to that, even if we are working on operational efficiencies, we are basically freeing up some time and effort for somebody, who's on the ground, and they could probably put that time and energy into making a decision. Like, for example, we have built multiple tools that are actually enabling folks to free up their time just so that, they can use all of that energy elsewhere. Like, I think there are two examples that come to my mind. We have built a tool called the offer filters, which is basically, used by the transplant hospitals to ensure, basically, it looks at the past 5 years data, and it will catch trends and patterns in the acceptance practices. So what it does is, if you will not be, if there's a probability that you will not accept a certain kind of organ, then those organs actually are bypassed to the other hospital that may have more likelihood of accepting an organ like that. So what we are doing here is we are saving cold ischemic time on organs. We are also helping hospitals, because honestly, like, when they get offers, it's a huge, I won't say data set, but basically what they get is a lot of offers and a lot of like decision points. In an hour, it's only so much a person can do. So we're streamlining a workflow. However, that's actually aiding to better decision making and making sure that this gift of life is actually going to somebody who can really make use of it. So I think there is a combination that you can work with, basically, if you have that kind of context.
Very important and critical. I think what everybody does is critical, but even more, matching the patient with the right organ at the right time. It's very time sensitive. There's really very little room for limit for margin there on error. Does anybody else have any, before I close that question out, I want to make sure I get everybody's perspective there. Does anybody else want to add to that, or we've got additional questions that I want to try to get to here before we close out as well? Okay.
Final closing thought on this is also think about the analytics or the efficiency of your analytics team. What's creating friction for them? Because a lot of times, speaking for kind of like a pseudo CDL, AO, we just don't have enough data science. We just don't have enough analytics professionals. So anything you can do from a platform perspective, from a data integration perspective that we touched on, that makes it easier for the folks that tell the stories, or that help get the data ready to help healthcare organizations improve, is a good investment.
Good point. And the next question that comes across from you, I think is critical. It affects everybody that's on the panel. And that's when building AI models that interact with PHI, what unexpected regulatory hurdles, everybody's affected by this, have you encountered, and what creative solutions have helped you stay compliant while pushing innovation forward? That's a great question. Mayank?
Yeah, probably I can take. I mean, I think it's very pervasive. I mean, on one side, within healthcare, we have these regulations, and on the other hand, obviously from a cost standpoint, a lot of these organizations are working in a nearshore or an offshore fashion, right? So we are kind of trying to balance in that space on how do we still keep the innovation in a cost-effective fashion, but at the same time also don't kind of go against the regulation and compliance. And one of the ways that I have seen to have it work is twofold. So there is people have this general misunderstanding on when we talk about PHI, PI, what does that mean? The first and foremost is it to a lot extent, it kind of ends up meaning on how you're using the data, right? So if, let's say, I have a data at hand and I'm able to see that I am trying to make or use that for making outreaches to my patients or providers, and if that is being done by somebody offshore, then that's a big challenge. That's a big no-no, right? But let's say if you are using this data in an aggregated fashion for internal reporting, and some business leader or operational team is trying to make aggregated decisions on the direction that they should take, I would not say that that is a general policy of the PHI, PI thing. We are not kind of abusing that, because I'm not looking at the individual patient records. I'm not trying to see that this particular member has this particular service that they have taken at this particular point in time. So that's the first thing, right? A lot of this is in the context in which we are trying to use it. And then there are policies in your organization. Policies should be defining those contexts. That's point number one. The second thing that I've seen working from an analytics standpoint is you can always mask or de-identify your data, right? So, for example, let's say in your given data, if you have patient ID or provider ID, and if that is one of the safe harbor elements that you cannot kind of use in an offshore fashion, just de-identify it from an AI model training perspective. It does not care to understand that who is the patient behind the scenes or who is the provider. What we are looking at as the correlation of all the other elements and then the outcome for which we are training that model. So you can always do that, create those de-identified data or kind of, I'm not particularly saying mask because at times we kind of end up using some of these identifiers, but you can always de-identify the data in a fashion that it cannot be traced back. And that can be in a way used for training your models. Once you have the model outcome, I mean, there are patterns in which you can take the model outcome, attach it back in an onshore integration, back with the patient or the provider for which you are trying to get that score, and then use that for whatever outreach. If you're trying to use that for an outreach to the patient or provider, somebody sitting onshore can have that access, and they can, it will be an on-the-fly conversion back from the de-identification to kind of the identification of that particular consumer, and then make that action. So it can be integrated. The data science folks or the data analyst folks sitting offshore who are accessing this data, they don't have to know which patient or provider are they talking about or working for.
Thank you for that. We're running up against the clock here. I appreciate everybody's time today, and we've got another question that we'll answer offline. I unfortunately couldn't get to it. We have so much that we had to get to today, and we didn't cover just barely a few questions that we really had hoped to get to. But with that, I want to thank everybody, and Nitin, I'm going to turn it back over to you.
Thank you, guys. We would like to express our appreciation to all our community partners who have been us till today, all our distinguished speakers for today, which is Mayank, Laura, Neelam, Tim, Glenn, and obviously moderator Mark, who stitched all the points together. Thanks to all the attendees who engaged in this forum, and this has created a space for knowledge enrichment. All the panel members were outstanding for today, and we value their willingness to collaborate and share the valuable insights. If you or anyone missed any part of the session and want to revisit it, today's event will be available on our company's YouTube page for your convenience. As exciting technological advancements are on the horizon, and we are thrilled to explore more in the coming year as well. Looking ahead, we have a diverse lineup this year, focusing on different sectors such as banking, financial, insurance, telecom, retail, healthcare, supply chain, manufacturing, and much more. We have a calendar in place also for the next year, so stay connected with us for this continuous learning. For more technological updates, visit our website and social media channels. We'll be sharing a wealth of knowledge, including details, announcement for upcoming events, and much more, which will aid you in getting the registrations done. We look forward to your support. Please like and share our content on the social media channel as well. A heartfelt thanks to InfoVision, who is our knowledge and innovation partner, and Digit7, who is our technology partner. To explore more, look at their websites, which is infovision.com, to delve deeper into technological advancements. We thoroughly enjoyed bringing this session to you and hope you found it as enjoyable as we did. As we eagerly anticipate more sessions with you in the near future. Take care and have a great day and year ahead. Thank you.
Thank you.
Thank you.